Good morning. I think we are going to go ahead and start. It's 8 o'clock. So I would like to start the workshop. First of all, of course, good morning. My name is Manuel Moro. I am a program official here at the National Institute of Health. On behalf of the Division of Comparative Medicine at the Office of Research Infrastructure Programs, which is within the Division of Program Coordination, Planning, and Strategic Initiatives, Office of the NIH Director, I welcome you to the One Health Integrating the Veterinarian Scientist into the Biomedical Research Enterprise Workshop. Before we start this, I would like to express our gratitude to all the members of the organizing committee. Here I have a list of all of them. Peter Ernst from the UC California, San Diego, James Fogg from MIT, Michael Kent from Oregon State University, Dr. Deborah Kochevar from Tufts University, Dr. Lackner from the Tulane National Primate Research Center, Dr. Ronald Sokol from the University of Colorado, and Dr. Susan Vanderwood from Colorado State University. I would like also to mention all and again express our gratitude to all the speakers that make this possible. One note that I wanted to emphasize here is the concept of One Health, and I'm sure most of you are pretty well aware of that. And with this diagram, I'm trying to express what is a traditional perspective here on the left side of the different realms, the human health realm, animal health, and environment health. And of course, the concept of One Health that basically is integrating all those realms together. The challenge for this workshop, of course, is to align the One Health concept to the NIH mission. And I hope that with your help and the discussion, you will provide us that feedback. So what are the objectives of this workshop? Is to provide information and advice on how the concept of One Health can advance the NIH mission in regard to both basic and applied research. I want to emphasize this is related to our research programs and also to the training of the biomedical workforce. A little bit about workshop logistics. We are going to have several discussion presentations. There will be time for questioning at that time, but also you have the option to submit questions or comments for the session or after the session for later discussion in the afternoon. Using you can submit your question or comment to this email that you see it here, and it's also in that flip chart. So anytime that if you want to remember you forgot about a question or issue, you can submit an email. That's an email from my colleague, John Harding. You can submit that, and then we will address that. We will try to address that question or comment later in the afternoon evening discussion. Also, I want to remind everybody, speakers, and anyone that has questions also, that this event is going to be video recorded. So please be careful when, for the speakers, talk close to the microphones, any one of these microphones. When you are asking a questions, please identify yourself clearly, mention your institution. We have a person here taking also scientific notes. So again, I want to emphasize that when you're asking questions, please identify yourself. Some other mention about break lunches. We have options to take a coffee or lunch. We have this is the Lister Hill Conference Room. We have a break room downstairs, a cafeteria in level B1. This is the first level, so you have to go. You can use the stairs to go there, or only half a block from here, getting out from the main doors. You have the Nature cafeteria. Also, you have a chance to go there, especially during the lunchtime. And with that, I would like next to introduce the director of ORIP, Dr. Franziska Grieder. Thank you.
Well, good morning, everybody, and welcome to Lister Hill and the NIH to what I hope will be a very exciting day and a half on One Health, one of my favorite topics. I almost had to say this morning that the dog ate my homework. I'm actually dog sitting right now, so it's a 5-year-old female black lab next door that I dog sit. When I went over there this morning at 5:30 to take her out and feed her, I thought, like, well, I take my introduction notes along, and lo and behold, she almost ate my notes. So back in 2007, the One Health, One Medicine concept was discussed, and to forge bonds between the AMA and the AVMA leaderships. And I was as enthusiastic about the topic at that point as I am now, 8 years later. Manuel showed you, and I did a little reading, we could do, say, research over the weekend, and found out that the two elements, the One Health, One Medicine, is now enhanced by One World, which represents the environment. So now it's people, animals, and the environment, which all play into this bigger topic of One Health, One Medicine, One World. And of course, me speaking with an accent, Manuel speaking with an accent, we both kind of like the One World aspect as well. Today's topic, however, is, as Manuel reminded you and everybody knows in the room, One Health, integrating veterinary scientists into the biomedical research enterprise. And that will bring together eminent researchers such as yourselves, who collaborate on critical topics that require the input from interdisciplinary teams. And that's what we perceive is so important. I expect that the discussions that will result from the presentations that we will hear and from having you all in the room today, I think it's important that we all interact, whether it is here in discussions, as Manuel pointed out, or over lunch break, or otherwise by email, will strengthen the multidisciplinary approach of both translational and transdisciplinary biomedical research. My hope and expectation is that this workshop will help build bridges between scientists which have different expertise, background, and experience. I also would like to acknowledge and thank the advisory panel who helped ORIP staff organize and think through the topics. Manuel mentioned the individuals already, Drs. Ernst, Fox, Kent, Kochewar, Lackner, Skrogal, and Vanwood. So thank you all, and thank you all for being here, and thank you to the speakers. And lastly, I would also be remiss not to mention that I truly believe that the group which is in the best position to organize this workshop is organizing it. ORIP's Division of Comparative Medicine funds veterinary scientists in biomedical research, but its location, as Manuel reminded you, in the Division of Program Coordination, Planning and Strategic Initiatives within the NIH's Office of the Director, works on and supports trans-NIH activities that are of interest to everybody who is in a categorical institute, everybody who works on a disease or on a specific organ or organ system. I think members of ORIP, members of the Comparative Medicine Group, are in a good position to help bring these diverse groups together and help you get organized. You already met Manuel. You will meet Jack a little bit later. And I think Stephanie, the director of the Division of Comparative Medicine, will come up next and introduce the keynote speaker, which then is my clue to say, have a great day to have.
Good morning. As Francisca mentioned, my name is Stephanie Murphy. I'm the Director of the Division of Comparative Medicine, and welcome to this workshop. It is my great pleasure to introduce our keynote speaker today, Dr. Carolyn Henry. Dr. Henry is a tenured full professor of oncology with dual appointments at the College of Veterinary Medicine and at the School of Medicine at the University of Missouri. She also wears administrative hats on both the human and animal sides of research and education through her appointments as the Associate Director of Research for the Ellis Fiscal Cancer Center, which is part of the University of Missouri Health System, and as the Associate Dean for Research and Graduate Studies at the College of Veterinary Medicine. Dr. Henry received her bachelor's degree in animal science and biology from Eastern Kentucky University before pursuing a DVM, followed by a master's of science in small animal surgery and medicine at Auburn University. She then went on to achieve board certification in the specialty of oncology within the American College of Veterinary Internal Medicine. As a veterinary oncologist, she is perhaps best known for her work on canine bladder cancer, but her research interests also include mammary cancer, osteosarcoma, as well as comparative oncology and cancer epidemiology. She is also well known for her expertise and application of One Health principles and goals. For example, in her role as faculty facilitator for her institution's One Health, One Medicine Mizzou Advantage initiative, Dr. Henry has been engaged in fostering multidisciplinary research and education relating to translational medicine and the convergence of human and animal health, both within her institution and with outside collaborators. Throughout her career and through her outreach efforts, Dr. Henry has emphasized the need to improve the efficiency and applicability of medical discovery by exploring the comparative aspects of diseases that affect multiple species, choosing relevant companion animal models to learn more about human diseases, and conducting well-designed clinical trials for the benefit of both human and companion animal patients. She was recently elected by her peers as a distinguished practitioner and fellow to the National Academies of Practice in recognition for her One Health efforts as well as her clinical and research activities. So please join me in welcoming Dr. Henry as she discusses One Health challenges for the 21st century.